Welcome back. You know, a lot of concerns lately about the different COVID-19 vaccine options you have now, from accessibility to fear of side effects, including infertility concerns. We have Dr. Stephen Alsip, an infectious disease specialist with Alabama Medical Group, here right now to talk about all of this. Dr. Alsip, thank you for stopping by.
Absolutely.
Okay, first I want to talk about the different vaccines. They're becoming more and more accessible now, but you have 3 to choose from. Say if you have allergies, should you lean towards one or the other?
Well, not in particular. If you have specified allergies about specific things such as polyethylene glycol, which is used in one type of vaccine and not the other, that would be something you talk to your physician about. They may even want to talk to an allergist. But generally, only the patients that have high-level allergies are the ones that are going to have reactions. People that just have pollen allergies or even allergies to some common medications probably won't have any trouble with the vaccine.
Okay, there have been a lot of questions about which one is best for me, but the CDC constantly says get the vaccine that's available for you when you're eligible. Do you side with that?
Right. You know, people look at the first 2 vaccines that were approved, the mRNA vaccines, and they either A, think that they're wonderful, 95% effective, and so they want to get that vaccine, or B, they're worried about the genetics involved because it's a new type of vaccine. And then they look at the second vaccine that came out, which is a viral mediated vaccine, and they see the numbers that are lower. But it's really apples and oranges. That third vaccine, if you will, the second type of vaccine that was released, it was tested against resistant virus variants, and the Moderna and the Pfizer, which came out much earlier, didn't have to face those resistant variants. And so those numbers have changed somewhat based on that. So truly, all 3 of them are effective. In the vaccine trials, anybody who got a vaccine and they after 2 to 4 weeks after their last shot, no one has died of COVID. Of all of those people that have gotten the vaccine, even if you acquired COVID, you didn't die of it. So they're very effective, all 3 are, and you should get whichever one is available to you.
There's still a lot of hesitation about getting the vaccine, side effects, including blood clots. Have you heard about that?
Well, they're worried about the AstraZeneca vaccine, which is not approved in the U.S. yet, and it may not be the next one that's approved in the U.S. either. There have been some concerns about blood clots. They've used it some in Europe, and now some of the European countries have put a pause on that. But that's the only vaccine where there's been reports, and they're not even sure that it's a cause from the vaccine. The 3 vaccines that we have available in the U.S. have common side effects such as sore arm, which is the most common, maybe fever, achiness, fatigue, and all of those things are very short-lived. Only rarely do we have a significant allergic reaction to those vaccines.
Okay, I'm being told we're almost out of time. What about infertility concerns?
Right. Theoretically, there's no reason for the vaccines to cause infertility. There is a CDC group that is following any pregnant woman that has gotten the vaccine during their pregnancy or before, and they have found no issues with infertility with that. And they continue to enroll patients there. They've had over 30,000 that have gone through that study group.
All right, thank you very much. Dr. Alsip, could speak with you all day, but yes, we are out of time. Appreciate you stopping by, though.
Absolutely, happy to do it.
And you can watch this interview, share it with someone you know. Look for it shortly on our YouTube channel, and be sure to subscribe so you never miss a story when we post it.